teachers are undertaking, and the outlook and importance of the school health program itself, so that in the collective bargaining that happens between teacher unions and the government, the welfare of the school health teacher and indeed the sustainability of the school health program is taken into account. So again, I introduce myself. My name is Mumana. I'll allow everyone else to introduce themselves. Thereafter, the headmaster will welcome us to the school and hand over to the chairperson of the Parliamentary Caucus School, who will brief us a bit and allow for the introduction of the delegation to the caucus, and there will be guided. So we'll start this side, introduce ourselves, and after headmaster. So we can introduce yourself. If you are from the organization, if you are from the do that, then you must.
I'm the grand health teacher. I'm Zambian Christopher. I'm the Deputy General Secretary in charge of organization. I'm coming from the tools. I'm representing my general secretary. My name is Mumana. I'm here to represent the school house. The ministry has what we call this time around, they are carrying out a joint annual review to review the education program. Otherwise, the director and the case of the year. There's a meeting at Mumana where they are reviewing the education program. So that's it. And then the core political school sectors in the education.
Good afternoon, everyone. My name is Good afternoon, everyone. My name is Gloria Shezongo, Mrs. School Health Teacher, representing Mumana. Good afternoon, everyone. My name is Baberi, School Health Teacher, Mumana Primary School.
Good afternoon, Honorable Teacher, and the Honorable MPs. I am Obi Michael Sana, Director of Public Relations for Good afternoon, Chair, and the Honorable MPs. Good afternoon, colleagues. Alabisa Abraham, Director Sage and from Zambia National
Good afternoon. My name is Kenneth Kamurambo from National Assembly, the districts of the Parliamentary Caucus on School Health. Thank you.
The chair, the vice chair, all the MPs around, the teachers, the guests that are here, and the people from the press. I would like to welcome all of you to Mumana Primary School. Mumana Primary School. We are a school starts from ECE to grade 9, and the grade 9s that we have are the last grade 9s because we are transitioning from a basic to a pure primary because of the new curriculum that we just started. So come next year will be a pure primary. Then we also have the special needs. We have learners who have the special needs. Then we have a staff of 78 teachers and support staff 8. Our population is 2,486. That is our number. Then we run the school health program, which is a good program. Make sure that all the learners are healthy, and the school health teachers take the responsibility of checking on the learners. Those that are not well at school, they are attended to there and then. If there is, we see that they are not, it's beyond them, then they are referred to the nearest health facility, where the people there attend to them. Then if they can't manage at that health facility, they are referred to the bigger hospital. And our nearest is in Mumana Hospital. So as a school, we are so humbled that you have come here to come and hear the views on how best we can help with the teachers that work in the health room. So we are very, very humbled, and we know that our contributions will greatly make a milestone. Because it is from here that every teacher in Zambia will benefit. So we'll give you the best that we can give. If there will be questions that we need to respond, we'll respond according to the way we are working in the health. So you are most welcome, because this is not my shop. It's, so you are most welcome in Mumana. The geography we are near here, so we have 2 rooms. For the ladies there and there for the gents, but we also have in the administration. So that's the geography of Mumana. Thank you so much.
Thank you. Well, thank you so much. How will you stand? As a teacher, I told you always stand right. We all have a teacher. So speaking of the teachers here, and I know most of the union leaders here will not teachers, right? That means all of us as teachers. There is no one who will teach anyone. Okay, thank you so much for it. And apologies for the slight delay. You are at Parliament City, so our invitation is not to take a lot of time. Perhaps just in the space of 1 hour, we'll be able to be done the program that we intend to conduct today. Thank you so much, Head, for welcoming us. You have always been welcoming us. This is not the first time coming here, and this is becoming our home now. So you allow me to read through the few remarks that are here. Colleagues, in the interest of time, may I say good afternoon to all of you, honorable members and distinguished stakeholders. Yeah, maybe before I read the notes, you may want to know the members who are here. And I'll start with the vice chairperson of this caucus.
Good afternoon, everyone. Good afternoon. I'm Mumana, Member of Parliament for West, and a member of this caucus and several vice chairs.
So thank you very much. Acknowledge the presence of chairperson of caucus, the vice chairperson, and the other executive members. Acknowledge members of the various units. Allow me to simply say all protocols acknowledged. My name is Mumana Member of Parliament for Zambian Parliamentary Caucus, and the GS General Secretary of the Caucus. It's good to be back to Mumana.
My name is Tyson Zambia, Member of Parliament for Zambia. I'm the Vice Treasurer of the Caucus.
Another executive member. Thank you very much, welcome to you. Good afternoon, everyone. My name is Mumana. I'm Member of Parliament for Sierra Leone constituency.
Thank you so much. And myself, my name is Atuabo Mutinta. I'm a member of Parliament for State Constituency, which is in Zambian province. So thank you so much for it once more. On behalf of the Zambian Parliamentary Caucus on school health, indeed, on my own behalf, I would like to welcome all of you to Mumana Primary School for this joint health room familiarization tour. And I would like to thank you most sincerely for sparing your precious time to come and be part of this delegation. And once more, to the regional leaders and the other stakeholders, I want to apologize that we were supposed to have this meeting earlier today. We had a very serious commitment, well, as members of Parliament, we were invited somewhere. So apologies once more for disturbing your precious time and your precious session. Allow me to also thank health leaders, thank you, Executive Director through you, for the sponsorship that is coming to the Zambian Parliamentary Caucus on school health, and for in particular supporting this important event that we are having today. This familiarization to our colleagues is expected to help the stakeholders to appreciate the features of the school health room in its function, as simple as that. So the intention of this meeting is to allow our key stakeholders, particularly the unions, to appreciate these health rooms and to understand in depth the functions of these health rooms. These health rooms are for a long time misconstrued or misunderstood. When they look at how small the health room is, somebody will judge it. But what comes out of that health room, you can only appreciate it if you go there and understand what purpose it serves. So that small room there, it serves over 2,000 plus learners. And you'll be able to appreciate what it does, what comes out of that small room. So honorable members, distinguished stakeholders, from the onset, allow me to take this opportunity to inform you that the Zambian Parliamentary Caucus for the school health noted from the recent meetings that were held with various stakeholders. And these meetings were very successful. We held a meeting with Zanuti, the tools, the PS, and many other stakeholders in the recent time as a way of ensuring that this program is sustained and to ensure that it continues to expand across the country. And what we realized from these engagement meetings were that most of these critical stakeholders that we were meeting, they were not aware of the existence of the health rooms in our schools. So we found it very awkward to learn that the tools, Zanuti, and many other unions, they had no idea what a health rooms look like, what happens in the health room, and it is against that background why we initiated this familiarization tour to allow them to appreciate, as we discuss sustainability, they should also have the context of what is a health room and what happens in a health room. So honorable members and the distinguished stakeholders, as we walk through the health room there today, you will notice the well-equipped facilities, small building, but well-equipped facility, staffed by dedicated school health teachers who are present here. And you will notice that this room is designed to provide a safe space and a comfortable environment for pupils who may need medical attention or any support during the school hours. So you'll be able to have this context as we visit that room. And may I also take this opportunity to inform you that the Zambian Parliamentary Caucus on School Health is a good avenue for collaboration with any other stakeholder who believes in the agenda of school health and the many other issues that borders on the learning of our children in this country. The Zambian Parliamentary Caucus on School Health, it's available to collaborate on any change that you feel is appropriate to this program, and it is also open to any recommendations that you think we can build together around these issues, especially on issues that borders on the desire for legislation. If you feel that any pieces of legislation that are not in tandem with the agenda of promoting school health, our doors are very open, either from the teachers, either from the union, even from health leaders itself. This caucus is available to provide an avenue for you to champion that legislation that will ensure that school health is promoted and it's implemented in an environment that will ensure that our children are supported in their well-being fully. As I conclude, colleagues, allow me to thank you for joining us on this tour today, and I hope you gain a better understanding of the health rules and the important role that it plays to the pupils while at school. And I'm very sure that away from this tour, the unions and the teachers, you are already in a very good partnership. It might not just end here. There will be other opportunities where the teachers will showcase what takes place in the health through your interactions from the unions, because you are all coming from these unions and you are part of these unions. Having said that, colleagues, I want to thank you all. And at this point, I'll hand over to the school in charge so that she can take us in the interest of time to the health room and allow the teachers to respond to the questions that will come from the union leaders. Yes, but maybe before we go, through the powers vested in me as a chair, maybe I'll allow anyone from the union to say something as we walk that time. Just in a minute. Any representative you want to say something? You want to say something about something? Okay, so if you don't want to, if you don't have any issue now, you can say something at the end. But I thought there was maybe anything to do with how we want to go or what we want to see, but I think from what the headmaster says is already laid down. So I just head to the health room, enter there, then they will tell us what is there, you'll be able to ask any questions. Then you can quickly conclude by allowing we'll do the conclusion by allowing maybe one or two from your side to say something. So having said that, you can take us through the direction we are. Thank you so much.
Can you stand with your head?
Yes. So this is our
The ministry who are the owners of this program to this side.
So this is our health room. We have 3 screening spaces, and we have a table here where the health teacher on duty sits to screen the learners that are not well. We have a program. They can bring themselves here when they are not well. And then we have a program which we call the school health captains. So those school health captains, they ask their friends every day when they come, how are you feeling? If there's one who's not well, they have a duty to bring them here. So when they are brought here, they are being screened by the health teachers. So the procedure of screening, I will not talk about it. I will allow the health teacher to do that, because they are the ones that are here all the time. And these school health teachers that you are seeing, they use the tablet which we call the Think MD, which is Think like a medical doctor, Think MD medical doctor. So that is tablet. When they are using it, each school health teacher has a number that is being given. So they can open using that number. And then the information that is entered in there, it goes straight to our partners. So they have this information all the time that they are screening. The information is transmitted to our partners. And at the end of they meet every month to review how the work has been done. And then they have the referrals, they are written. The follow-ups, they're also written there, so that they know if this health teacher screened 15 learners, it has to be recorded. And those that were referred to the health facility, the school health teacher has to make a follow-up and record their findings. And also remind the parents if there are drugs that the learners are taking, that they should take the drugs. So for the process, I allow Madam Bessie just to take us through how they screen the learners. Madam Bessie.
Thank you so much. I'm only doing this not because maybe I'm the most knowledgeable among all the health teachers. I happen to be the focal point person for the program. Okay, so like she has indicated, the screening mostly will begin by the health captains. We have about 40 of them in school that are trained among the pupils. They are those that we select, who we know can be in charge of things and can be above board. So they will find out from their friends, starting from their classrooms, if there is anyone who's not well. And if it so happens that there is one who is not well, they will either direct them here or bring them here so that they are sent to. And I think we are at a point where now children on their own know what they're supposed to do when they feel they're not okay. So sometimes it doesn't even need to take the health captains to ask them if they are okay or not. If they just feel that they need to visit the health room, they will come through, and there's always a person to attend to them. Like you have seen, we have a timetable that is drawn that every school health teacher adheres to. So at any time during learning hours, the school health room is open. We are here, we receive them, we screen them, we have the registry where we enter the children who come to visit because they are not well, and with the help of the Think MDs, we are able to go through the process until the end, where it also determines what should be done to the learner. There are cases when a learner comes with a challenge that is beyond us, it will advise to immediately make a referral. And this same referral, it begins the fast tracking process. We begin from here. We'll give them this form, which they will go with to the clinic. And upon seeing the form, it means that this child is not even allowed to queue up, or they will not have to face the pressures of being in the queue. They'll quickly be attended to, so that either they come back to school and continue learning, or depending on how they are feeling at that point, they'll be advised to go home and continue their education from there. So from the same feedback, from the same referral form that we give them, there is a part that will be returned to us. They will tear off a certain part that will be returned to us. That enables the school health teachers that did the referral to review and see what kind of medication the child was given or at the clinic. And it also gives you further information on whether the child was further referred from the local facility to bigger hospitals. So other than that, within the 3 days of having screened the child, it's also our responsibility to make a follow-up. We follow them because all the information will have remained. The register will have the details of the child, the class, the teacher, and who actually referred them, who helped them to get to the clinic. So we follow them, we get them here, we sit with them to just find out how they are doing, if at all they are still taking their medication, or if at all they still feel that they need to be screened further. So there's quite a lot that happens here that meets the eye. We also do programs where we give health talks. So these health talks, sometimes we just look at what's prevailing. If we have so many of the codes, children coming through with colds, flus, and stuff, then we know it's time for us to raise to the occasion, give health talks on how they are supposed to handle themselves to prevent the colds and the flus, or even just to manage if they happen to catch the colds and the flus. And we also help during mass drug administration. You know, I'm sure we've heard of the Child Health Week. So because I think it's too overwhelming for the facilities, and sometimes if they call for Child Health Week, you expect all children to be at the clinic and that week. But then I think because of the coming in of this program, it has lessened weight because we are able to administer and lessen the pressure for the facilities. So we get together. First, before we even begin the mass drug administration, people from the facility will come with the help of people from our partners. They'll come and walk us through. They will give us the necessary tools that we need in order for us to implement the program. So we work as a team, we administer drugs, we record, and when they come to get the reports are always ready in time. There is also I've talked about the health talks that we give. Yes, so also it's also our responsibility to ensure that when we are identifying children to help, because when we train these so-called school health captains, they come in very handy because there are certain times that we can't be everywhere, but they are everywhere and they're interacting with their friends. So we get to have chances where they'll come back and report on issues that they meet as they're interacting. Bullying, it's reported, and it's something that we've been advocating against. Everyone knows it's our responsibility to ensure that the learning environment is conducive for everyone, beginning with just their health and even just the way they're interacting. We are teaching them on how to respect one another. We are teaching them on how you earn respect and how we can do it. So I think this is a very, very brilliant program. It's a very brilliant program.
Maybe take us through the features of this room before we open questions.
Okay.
It's interesting.
Okay, so we have this bench, maybe. There are times when it gets so overwhelming, especially if we have some outbreaks. You find there are a lot of children, and because they need to be seated or they need to be attended to, they'll sit there, and then we have the two chairs there. So normally, the ideal situation should be, we should be the two of us, school health teachers. One is attending to this one, another one is attending to another one. So this is where we conduct our screening from. Then we have an ORS corner. As you may be aware, diarrhea is something that you cannot avoid talking about. Every week, we should have cases of children complaining of diarrhea. So we have this ORS corner. We have an electric kettle every morning. We boil water. We ensure that we have boiled water for when we have children who are coming through with diarrheal cases. And in the event that we do not have power during the day, we have engaged the general workers, those that are on duty in the night when there is power. We've asked them to make sure that they boil water for us. There is a boiler in there so that in the morning when we come, we find water that is safe for use for our ORS corner. Most of the things that we use are here. There's everything from spirit, because you know this is a school, and you just can't run without having recorded incidents of injuries. They are playing, and you know sometimes they get to be rough and hurt one another. We have everything. We have gloves. We have all the drugs that we need. We have Panadol, and we also have MMT. So ideally here, the only things that we are allowed to manage are pains and minor cuts, even stomach upsets. Anything beyond that then calls for yes, a referral, and which we do. So these are the things that we use here, the tools that we use. We also have sugar. Just maybe people may be wondering. Our partners also support us with tea money every month. They realize we spend a lot of time here, and as a way of motivating us, they send us just a little token just to enable us get some tea. But then maybe they may not know that the tea that they send us goes beyond just us school health teachers. Sometimes it's extended to the little ones, because there are times you receive a child, and after maybe interacting with the child, asking them 1 or 2 questions, you realize that even besides them going through the pains that they are feeling, they are also hungry. So you cannot just administer a drug on an empty stomach. So sometimes the tea goes beyond us. We have to make a cup, and we actually even sacrifice. We dip into our own pockets sometimes. We get them something to take the tea with, so that even as they are taking the medication, there's something in the stomach to start off the medication. Okay, so we have the 2 rooms. You can just come here. One is for boys, and the other one is for girls. Yeah. There are relief rooms for when they are, sometimes we are forced to keep them here to observe them. Yeah, so we have 3 beds. There's the bed, and this trunk you are seeing holds serves as storage. We have drugs, the drugs that we have not yet opened. So once we run out of that drugs on the table, we have backup in the trunk there. And the things that we use for cleaning. Yeah. There is another bed. And we have also this facility that was given by our partners, health learners. So this came through because of the challenge of power that we have been facing. Our gadgets there rely on power. So if I go for days without power, those gadgets will not work. And once the gadgets are not working, we are not allowed to give any medication, because there is nowhere where we are going to get the protection from. We are asked to enter whatever drugs that we administer, so that in case of anything, the gadget should show what kind of drugs you administer. So in the event that the gadget is not there, would not work. But when we complained, when we pushed that in as a challenge, they thought of this initiative. They provided us with this charging facility. We are able to charge the gadgets, and also even the phone that was supplied by our partners. The phone also, every month, they ensure that they send us 100 patch out of talk time that we use, because we have to make a lot of calls when we are dealing with these children. So this is it, where we keep the charging facility, and the panel is out on top there. Then we have the hand washing facility. Here. The hand washing facility there. So pretty much, unless
yeah, that's enough. We've got questions.
And to measure the height.
Oh yes.
And the scale. Okay.
Because these are some of the requirements as we are doing the screening process.
The chair.
What's the height?
1.8.
Okay. Yeah, so let's allow questions, colleagues. In the interest of time, we know we have people's programs, and we need to rush also Parliament.
Just one question, Chairperson. Firstly, like I put it, is an excellent program, very good program. After whatever we are doing, I came also with a patient, it's a boy, that I would love you to check one or two things, the boy is here. So, but before we do that, let me ask one, two questions. On this excellent program, do you have statistics as to how many cases you have referred to data facilities per month? And from there, according to the records, are the cases increasing or they are coming down? Very for that's what I know. Thank you very much.
You can take 3 questions. In the union, either a comment or a question.
We just wanted to find out the program. It's a very good program. Is it government funded or donor funded? Because we are very worried that in the event that it's funded by other people, the moment they pour out, they know the gains that is made would have gone down.
Okay.
Yeah.
That one is education once.
Yes, sir.
Another question.
Yeah, that's additional to the issue of personality. I wanted to learn, especially on the cases we are referring to, the clinics and hospitals. We talked of those facilities having a lot of pressure. And we also said our pupils are attended to at an express rate. Are there instances maybe that we've observed that maybe our children, because of that pressure there, they will delay to be attended?
Okay.
Are there such instances?
You can answer the 3 questions.
Okay. We start with the
Whichever was the statistics.
Thank you very much. And I will answer the first question that the vice chair. Yes. So the statistics, yes, we do take the statistics on daily basis, in the sense that when the child comes, before we interview that child, what is wrong with that child, we do record, as the madam has said, that we have the ID numbers and then the date for that particular day, and then the name of the child, the class teacher, as well as the parents. So every day we record some pupil learners who are not feeling okay. So those statistics are here. Maybe on average, on a day, we can have maybe 20 to 30, or sometimes more than that. So on those days whereby, or as we are in a cold weather, most of the problems is maybe a cough, a flu, or respiratory problem. So we do refer those to the clinic since we don't have medication for such illnesses. So here we just administer Panadol for the pain and what my colleague has already said. So yes, we do have those statistics on a daily basis.
So in a month, what's the average? The ones you refer?
So the ones we refer in a month, maybe more than 40.
Okay.
Yes.
Those you admit, those you deal with here.
So those we deal with here, there are those cases whereby a child is complaining of severe headache. And there are those beds when we give Panadol, we give time to see if the child will respond to that Panadol. If not, since we have temperatures, a child with high temperature, we give Panadol immediately, we enter in this think MD, then it will tell you to refer to the hospital. Then we do refer those. But those we can handle, after giving them Panadol, we make sure 15, 20 minutes, we tell them we observe it. So sometimes you find that the last session ends at 17 hours, and maybe a child has come, maybe not feeling too well. You have to make sure that you administer that child, and then you can't close the health room before releasing that child or communicating with the parents to come and pick up the child. So it's a bit of a process, yes.
Yes, we can move to the other
Maybe
question.
for my follow-up just a bit.
This one.
We have, the numbers are quite high, because what we've observed is because of the fast track system. So parents, they do not want to go to take their children to the health facility because they'll be in a queue. So most of the times they tell them to say, go to school, you'll be attended to, then they will refer you there. where they attended university track. So those are the instances that we have come across. There are many. A Monday, more especially Monday, you just open this health facility at 7 hours of the health, then or maybe a number of them, they will come straight here. Then you ask them, when did you start not feeling well? Then they'll mention maybe Saturday or yesterday. But why did they take you to the hospital? No, it's because they say at school, it will be a fast track, or maybe my mother is busy. So there are those answers. That's why the numbers are quite high. You might not have those like, why are they not reducing? Because back home, they prefer their children are taken to the health facility by the teachers because of the fast track.
Okay, maybe let me just even take the last question because it has to do with fast tracking before the other one comes in. The only time that maybe they will delay being attended to is when they have not presented the referral form at the health facility. When we were being trained, we also had people from the health facility who were trained. So the moment they see the referral form, they know this child has to be attended to quickly. So I think we've not had instances where maybe people have come back complaining. The only other time that they will come back complaining of not having been attended to quickly is if they've gone to a facility that is not aware of the program, because there are those who go to private hospitals. Yes, they go to private hospitals and think the form is going to save them. I think in those cases, the form, because it's strange to them, they don't even know about it. The only time that the form will save them properly is when they go to a facility that is aware of the programs that are running in school.
Okay, I think you can see that other members are beginning to step up because of the commitments, but we don't want to cut your questions. Anyone else? Yes,
yeah, there's this question from Minister.
Minister, please answer sustainability.
Thank you, Honorable. This is a program which is run jointly by government and our partner health learners. If you may recall, I think during my time when I was going to primary school, we used to have what we call sick days in a corner in a classroom. But now we're moving away from there and improve, turning these sick days into health rooms. So with support from health learners, we are running this program, and this is a government program which has come to stay. Just last week, we were called by the Presidential Delivery Unit. We had a meeting with them with health learners to see how this program can be sustained. And we made the budgets. So it's our hope that, when this budget goes to Parliament, the honorable members who are here will support us, because we want to have a funding line for this program. So this is a government, a program run by government with partners. Let's support it. It's for our children and for our country.
Thank you. Just an addition. So I happen to be the budget focal point for the School of Education Department. We have three pillars, which are what they call units under School of Nutrition. So currently, only the school feeding program is being funded by government. The wash pillar is not yet being funded fully. It's only a component of sanitary towels. I'm sure schools do receive sanitary towels. That's a component. And then, yes, all the schools, all the public schools, all the public and government-aided schools should receive sanitary towels. So the health services pillar is not yet, doesn't yet have a budget line as of yet. But we propose to Ministry of Finance through a budget policy paper, at least to start with 50 million. So we are hoping that maybe come 2026, we'll be given that budget line under the school health services pillar and also under wash pillar. And also maybe to add on the referral form, we have an MOU with Ministry of Health. So immediately they present that to any public health facility. The children should be able, the learners should be able to be attended to, in a fast track form. So that's what I thought of adding.
Okay, I'll just also allow the head of policy government to comment, then we can get back.
Yeah, so the clear-cut answer is that the school health program is a government program. It's a government intervention in schools to ensure that learners are healthy and they learn healthy and have both education and health outcomes. For some of us that went to boarding school, we know that we're coming from a past of sick days. There were transition rooms you fail, the Red Cross prefects will take you on a stretcher and so on and so forth. But now, government, through of course our technical support, is designing a robust school health services intervention. So it's a government program that's being implemented jointly by the Ministry of Health and the Ministry of Education, and now local government coming in and other line ministries to make sure that it is sustained. They're coming in as an external technical partner, but the main players of it are government, the ministries, the teachers, and those that play the most important role.
Thank you. We have any other intervention?
The question is the question on issues of referral. Because the children who are in the 6. Now,
We have even as young as 3 now. The new curriculum.
Now, when you talk of different, who do you allow to go on their own? Or do you call parents to come and tell you this? How do you handle the referral?
So in as long as it's a referral, then at that point you have to notify the parents, because we cannot take a child to the facility without the consent or without the parents knowing. So what happens is once we are directed to make a referral, we'll even call the parents to notify them. If they're able to come through and pick the child, then we wait for them here. They come and get the child together with the referral check. So there are instances like my colleague had mentioned, you are not able to reach the parent. None of the numbers provided are going through. Then now we take it upon ourselves because we know that we are protected. We just approach the administration. We ask them if they are able to help us at that point. They'll provide us with transport, or we just organize among ourselves. There are those of us who drive. They'll sacrifice that, which we take the child to the facility.
Okay, so we need to be winding up. Last one from the
a quick one, Chair. As implementers, what challenges do you face as you are implementing this program as teachers? Does obligations in class and giving this other responsibility? What major challenges do you face? Of course, as you were explaining, you said you had the challenge of how to get power and the like, and what other challenges do you quickly come up and say, this done, then this will happen?
Maybe, Chair, before they respond, a question that gives us legitimacy. You who are implementing as teachers, do you think you deserve incentives? Do you think you deserve an allowance? Because as unions, we don't speak from now. We must get legitimacy, particularly from you, the dear colleagues who are in this task. The task, I'll call it extra duty you are doing. Do you think you deserve an incentive in the form of an allowance?
We do. That one, we definitely do. Much as we know, when we're being interviewed, we went there willingly. We knew, we understood it was on the voluntary basis. But even as parents back in our homes, even when we see that a child is putting in extra, there is always a way in which we motivate them. So I think even the teachers here, they do deserve that, because what they put in, I think we go beyond what the normal should be as teachers. We are trained to teach, but then we also thought it wouldn't hurt to go an extra mile in helping a child who is in school and placed in our care. So if this child is here, and if I can go into my own pocket because I feel for this child, I feel even somehow, somewhere, we should also be felt for. There is not only the dipping in of our pockets that we do here, there is also the time that we invest in this. While others are knocking off at their normal times, we have to sacrifice to remain behind because there is this extra service that we have to offer. So I feel under humanitarian grounds, we just deserve.
We know that this program is going to be open, and the implementers, the teachers, of course, as labor movement, we shall need to sit down and see what is actually inside so that this program is adequately executed. Thank you very much.
Well, thank you very much. Do you have anything on the journalists? Overtaken by.
We actually have questions for them.
For them.
Mhm.
Ask them. The union, they're here.
Yeah, the unions. Oh, I thought it would be a side interview.
Okay, no,
Away, yeah.
if it's detailed, if it's detailed, I think we can. Yeah. So I think for the unions who come here to familiarize themselves with the government program, we thank you. And I think as members of parliament, which are through the caucus, working with health learners, which is also cooperating with Ministry of Health and Education, we share the same. I can just say we share the same passion for this project to succeed. Rome was not built in a day, so it's also critical that in such conversations we should be realistic, because that is how it should be. Apart from being realistic, we must also be fair. So it's a healthy balance, but sufficient to say, I think we thank you, Warhead, for hosting the caucus as you usually do. I've known Mumana for over 23 years, because I was at Mumana Boys here. So I used to walk down to go to Mumana, you know. So I think I thank also my colleagues, the members of parliament who came here. And for us here, we're going back to the house. Unless if there are any burning issues later, that we can allow the media to engage with the union and the head separate. For us, it would be. Thank you very much.
Thank you so much. We're so grateful that you came.
You're supposed to sit there.